Hi there. Welcome back. It's been a whole year since we've seen each other last. I know time just flies, but I'm glad to see you. So we are doing your physical exam, yearly checkup. And I'm just going to be checking various things on your face, on your head, your hair, and your body. So it will be quite detailed, but hopefully quite relaxing. So these checkups are just routine, just basically to always make sure there are no major issues and catch symptoms before they turn into problems in the future, and to treat them as soon as possible. So that is the purpose of your visit today. Alright, so I do have your file here. And can you give me your date of birth? Great. Okay. And how is your family? Right. Right. Okay. Well, that is good to know. I simply would like to know these things just for genetics and history of medical care in the family. So that is important. Okay. Lifestyle. So have you been doing well? How are you feeling overall on average? Okay. And have you been smoking any cigarettes, marijuana, anything I should know about? Okay. And alcohol consumption, do you drink? And if so, how much on average? Okay, very good. Okay, and how has your diet been, your nutrition? Have you been getting a lot of water intake? Okay. Let's say, how many meals do you have a day, and how many of them are microwavable, so to speak? Okay. 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 And how many glasses of water have you been drinking a day? Okay, yeah, definitely have to up your water intake. Okay, how's work? Stress levels, how are they doing for the most part? Okay. Okay. And how is your sleep? How many hours are you getting every night? Okay. I think you had the same problem last year. Yes, I do see a note of that. Okay. No problem. Alright, my dear. So I'm just going to begin by taking a look, okay, at your head and your hair. I'm going to work my way up and then down, okay? Okay, very good. So let's begin. So my hands are now sanitized and washed. I'm going to take a look at your face, and I'm just going to come in here, and I'm going to also be feeling your hair. Okay. Okay, Do you have any tenderness at all? Any sensitivity in these areas that I'm pressing? Okay. And I'm just gonna press here, just along your sinuses here. Okay, very good. Alright, and you are looking good as far as skin coloring. Everything looks healthy. Okay. And I'm just gonna feel your scalp here. Alright. And I'm just feeling, make sure there isn't any sort of bumps, any lesions. Okay. Even distribution of hair growth, no bald spots. Okay. Good. And just feeling here. Just gonna press a little bit here on the top of your head. And just let me know if there's any dullness, any sharpness, or any odd sensation. No, nothing. Okay, very good. Very good. Great. Yes, you are doing just fine. Okay, good. Okay. So no sinus issues, no pressure there. And you haven't been sick in a while, right? Okay, good. Okay, perfect. And I'm just going to ask you to make some facial expressions for me, okay? I'm going to be looking at the symmetry of your face. I'm going to be making sure there isn't any weakness in various spots. So if you can go ahead and give me a beautiful smile. Just glowing. Beautiful smile. Okay. Good. And you can let that fall. And can you go ahead and puff out your cheeks like a blowfish? Perfect. Okay, just gonna press a little here. Okay, and just keep them blown out. Perfect. Okay, you can rest. Very good. And I'm gonna ask you to close your eyes. And I'm just going to try and open them, but make sure you resist. Very good. Okay. And can you go ahead and give me a frown? Sad. Okay, very good. Okay, you can let that go. Everything is looking just fine. Alright. So symmetry is looking good. I am not noticing any facial muscle weakness. So that is very, very good. Okay. Okay, so everything is looking good here. Just taking a look at your septum. I know sometimes you struggle with sleep, so I just want to take a look there, make sure there isn't any deviation in the septum. Sometimes breathing issues can interrupt the REM cycle and various forms of sleep apnea. So I just want to double check that. I will be listening to your heart and lungs and making sure you are breathing well. But everything is looking great. Just good. Okay, perfect. Alright, so I'm going to ask you just to keep your facial expression flat, and I'm just going to press at your temple area, okay? sort of pain or achiness there? Any kind of achiness? It's okay. Okay. And I'm going to press right here. And I want you to open up your jaw. Okay, and can you close your jaw? Very good. And can you open your jaw again? Okay. And go ahead and close your jaw. Okay. Perfect, perfect, perfect. Yeah. Okay, good. I'm going to take a look in your mouth. Yeah, not much changes around here from the day to day. So it's always nice to see your face and your beautiful smile. Okay. So let's get one of these. Okay, perfect. Alright, so I'm going to have you open your mouth for me and just relax your tongue, okay? And if you don't mind, I'm going to ask you to stick out your tongue for me. I'm just going to take a quick look, okay? Yes, so stick out your tongue. Alright. Okay. I'm just taking a look here at the color of your tongue, as it does help indicate overall health. And it's looking like a very nice pink color. The flesh, there's no lesions or any infection. Looks very good. Okay, you can put your tongue back in your mouth. Okay, and I'm just going to look around your mouth a little bit. So keep your jaw nice and loose. Okay, good. Okay, I'm looking here at your teeth. Very good. Looking there. And you have overall very good gum health, and your teeth look very nice and white, very healthy. You're flossing and brushing, making sure you keep good dental hygiene. Okay. And I'm just going to look here. Yeah, everything is rooted very well. Just going to press down on your tongue a little bit. Okay, try not to resist. Thank you. I'm going to take a look at your tonsils, okay? I'm just going to take a look at your tonsils. I'm going to take a look at your tonsils and just make sure that the color is good. I don't see any infection, any inflammation or redness. Good, very nice. I do notice that there is a little bit of a drip at the back, but I think that might stem from your seasonal allergies, yeah? Okay, good. I think drinking some more water will definitely be beneficial, okay? Just to help drain that out a little bit. Yeah. Okay, very good. And you can always get a over-the-counter saline solution for that, just when you find that it's getting to be a little bit much. And you can take some allergy medication too, okay? Yeah, don't suffer if you don't have to. Okay. So now we are doing what is often our patient's most favorite part of their physical, and that is facial sensations, okay? So I'm going to be doing a little test on you and making sure that you are feeling the sensations all over your face, okay? And I'm going to do the same thing with your arms and your hands. differently in different areas of the face, and you just let me know if you feel something dull or a little bit sharp. As you can see, this is a blunt object, and it doesn't feel sharp as in painful, but it's certainly not quite as smooth as this end here, okay? Okay. So, I'm going to be tapping on the side of your face, just here. And you can close your eyes if you'd like. Good, okay. And I'm going to tap, and you let me know if this is a sensation that is sharp or dull. Very good. Okay. Very good. Good. I'm going to do the other side, okay? Just over here. Correct. Very good. Very good. Good. Okay. Perfect. And I'm just going to trace your face a little bit with my hands, okay? Let me know if you feel anything different on each side. I will be doing the same tracing sensation over your face, and it will be exactly the same, okay? But if you feel something off on one side, let me know. Okay, here we go. How does that feel? Okay, the same? Okay. Feels very tickly. Okay, good. I'll do the same thing. And how's that? Okay. Okay, exactly the same. Perfect. That is what we like. Alright, now I'm going to be doing the same tracing sensations down your arm. And just let me know if you feel anything that is sharp or dull. Okay. Alright, close your eyes. Alright, and you can just rest your arm in my hand. Okay. Perfect. So let me know. Okay. 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 Yeah. Perfect. Okay. And I'm going to trace down your arm, okay? And just let me know if you stop feeling the soft part, okay? Just let me know if you stop feeling any sensation. Okay, you can rest your arm. Perfect. And I'm just going to go down your arm. Okay, and now I'm going to do the same thing with this arm. Okay, and I'm just going to trace down your arm. Perfect. And so it felt the same. That is wonderful. Okay, so that is good to know. So I'm going to be listening to your heart and your lungs, okay? Great. I'm going to have you expose your chest, please. Okay. So, I'm just going to have you relax. And I'm going to place this here. Okay. Perfect. And I'm just going to listen here. Okay. And just over here. Okay. Very good. And can you go ahead and take a deep breath in for me? Okay. Can you do the same thing? Okay. Very good. And just this side here. And go ahead and take a nice deep breath for me. Okay. And go ahead and take a nice deep breath in. Okay, good. And I'm just going to come around here and go on your back. Okay, darling, go ahead and give me a nice deep breath in. Very good. Okay, and again. Very good. Okay. And just on this side, okay. Go ahead and give me a nice deep breath in. Very good. And another one, please. Perfect. Okay. Why don't we spend some time looking into those ears, okay? But before I do that, I just want to feel a little bit. Okay, so is there any tenderness? Feels normal. Good. Okay, and I'm just feeling the cartilage here. Okay, very good. And just feeling here. Okay, and just massaging back here. Okay. Very good. Everything feels nice and normal. Okay, good. I just want to take a look inside your ears, okay? So I'm just going to come around on this side and take a look into your ear canal here at the eardrum. Okay, everything's looking very clear. No wax buildup. Okay, perfect. Yeah, everything looks very healthy. Very happy with that. Good. Okay, I'm going to go in a little bit further. Look at your inner ear. Okay, good. Okay. Alright, and I'm tuning fork here, and I will be testing your ears. And just let me know when you hear the ringing sound, and let me know when it stops, okay? Very good. I'm going to do the same thing, okay? Just let me know when you hear the sound and when it stops. Okay. Very good. Very good. Other side. I'm going to put this at the top of your head, and just let me know whenever you stop hearing it, okay? Okay. Again. Coming up here. Your hearing seems perfectly fine. So I do have an eye chart here, and I will be going row by row, and you just let me know the correct letters that you see, okay? I'll let you know if they're correct. Let's not get ahead of ourselves. So, okay, very good. Very good. It's a little bit small. Yeah. Okay. That was very good. Okay, now it's getting very tiny. That's okay. You did a very good job. You did a fantastic job on that eye chart. Very good eyesight. Okay, so I'm just going to take a look at your eyes, and you can just relax, blink as you wish, okay? I'm just going to be shining a very dim light on and around your eyes, okay? And I'm just checking your pupils. an off yellow or a hazy look, then that's usually something to be worried about, but very beautiful, milky. The whites of your eyes, and your eyes are fantastic. They're beautiful, and everything seems to be working well. I'm going to cover one eye. I'm going to cover one eye at a time, and I'm just going to shine lights here. Okay. Okay. Very good. Okay. Very good. And here, I'm just going to do the same thing. You're doing fantastic. Okay. Just gonna cover the Foley. Good. Okay. Perfect. Okay, yes, everything is responding as should. Very good. And I'm just gonna feel your eyes here, okay? Just gonna press a little. Okay, I'm gonna press along your brow bone. Okay. Good. Very good. Perfect. Okay. Everything is good. Okay, I'm just going to feel along your neck here. I'm going to feel your lymph nodes. Okay. Just going to feel under here. Very good. Okay. And I'm just going to check your skin and the color. Make sure there's no concerning areas here. Okay. Okay, just feeling your shoulders. Good, very good density here. Okay, I'm going to put my hands over top of your shoulders and just lift as best you can, okay? I'm going to just put a little resistance here. Okay, good. Okay, and release. I'm going to do the same thing, but I'm going to press a little harder. Okay, go ahead. Good. Okay, I'm just going to feel along your arms here. Okay. Good. Okay. Well, everything is healthy there. And the strength is good. And you respond well with resistance. I'm just going to feel the overall temperature of your skin. Okay. Warm to the touch. No lesions, no infected areas. Okay. No bumps, no bruises. Very good. Okay. Good. Okay, this side. Very good. Okay. Good. Good. Perfect. Okay. And I'm just going to feel your abdomen. I'm going to tap and just let me know if you feel any sharp pains or anything tender or discomforting, okay? Anything at all that's an odd sensation, okay? So go ahead and relax your stomach. Okay. Okay. Okay, just a little squeeze. Okay, good. Alright, okay. And I'm just going to make sure your reflexes are working. So just a light tap on the kneecap, okay? In that area. So go ahead and rest your knee for me. Okay, very good. I'm going to do the same thing again, okay? Very good. Okay, and on this side. Very good. Okay. All right, darling. Everything is looking absolutely fantastic. I am going to be referring you to a sleep clinic. And I do want you to spend some time looking over your nutrition and your water intake, as that definitely can affect your moods and your overall well-being, okay? Yes. So, otherwise everything is looking great. I do want you to get some allergy medication and a saline solution to just wash everything that may have been caused by the allergens. Yeah. Okay. So, otherwise everything is looking great. I hope that you have the ability to go to the sleep clinic sometime in the next couple of weeks, just so they can make sure that it isn't a sleep apnea issue and that it is indeed from the swelling from the allergy that might be causing nighttime issues and breathing problems at night, okay? Yeah, it's also important that you change your bedding and keep your room as dust-free as possible, okay? So, just going over the checklist, your head and neck, everything was looking normal. Tonsils, lymph nodes, normal. Abdomen, everything is fine. No tenderness, healthy liver, muscle strength, perfect. Reflexes, great. Skin, healthy. Okay. Okay. So that is another year of your examinations. I will see you again, and hopefully you enjoy the rest of your week. Until next time, see you soon.